Final few minutes here for Breakfast Extra for a Sunday, and welcome back. Now, we're about to segue into Wellness Central, and of course, today is dedicated to your health here when we talk about prostate health generally. We're talking a topic that affects millions of men worldwide. But what exactly is the prostate? Well, the prostate is a small walnut-sized gland that plays a very big role in men's reproductive health. It's located just below the bladder and surrounds the urethra, the tube that carries urine and semen out of the body. Now I see why Judith made me tell you exactly what prostate is.
And as men age, the prostate can enlarge, leading to a condition called a benign prostatic hyperplasia. There we go. Now, this can cause urinal problems, including frequent urgent need to urinate, especially at night. But that's not all, by the way. Prostate cancer is also a major concern. It's the second most common cancer in men worldwide. And early detection is key, as symptoms often don't appear until the cancer is advanced. And that's why it's important to know the risk factors and take preventive measures as well.
Now, a healthy lifestyle, including a balanced diet and regular exercise, can help reduce the risk of prostate problems. But that's just us telling you. How about we get a doctor to do the rest of the telling? Today we have Dr. Adefolami Agunbiade, public health physician here. He'll be sharing valuable insights on prostate health, including symptoms, what to watch out for, screening recommendations, and lifestyle tips to keep your prostate in top shape. Dr. Agunbiade, you are welcome. Thank you very much for joining us.
Yeah, thank you very much for having me. Although you guys have practically said everything.
I'm sorry.
The little layman version.
Yeah,
you're the expert.
Well, you're the expert.
Okay, so just as you mentioned earlier, the prostate gland sits below the bladder, and it serves a very critical function. The tubes that connect the bladder and that come from the testicles, they run through it. If sexual function was like the Olympics, then we would say that sperm are the swimmers, and then the prostate gland produces the water that they swim in. Okay, so most of the symptoms you will see fall around that transport of things through the tube that runs through the urethra. Okay, so there are three conditions, as you mentioned. You have prostatitis, which is usually caused by infection or inflammation of the prostate. You have benign prostatic hyperplasia, which is also known as an enlarged prostate. And then you have prostate cancer. So those are three common conditions. For the prostatitis, you have like two categories. The acute prostatitis, which is usually, the common cause is a bacterial infection. And most of the time when people have it, one of the things they will notice is that they have this like burning urge to urinate. When they're trying to urinate, the stream is, when you want to urinate, it's not flowing heavily. And then the usual things that you see with infections, they have chills and fever. So most of the time, it's easy to confuse that with other STIs, because in practice, you would see patients who come in, they think they have an STI, and what they actually have is like an infection of the prostate. If you see your physician, your primary care physician, and they prescribe a course of antibiotics, usually it clears it. Chronic prostatitis, which is chronic inflammation, usually that's a bit much more difficult, because the causes are not particularly well defined or well known. Most of the time when people come, they'll just tell you that they have frequency, they have urgency. That means they feel like urinating frequently, then they have urgency. So in that particular case, you treat on a case-by-case basis. But the other two, the benign prostatic hyperplasia is, as it's called, it's benign. That means that it doesn't have like major significance for mortality. Okay, hyperplasia is not cancerous and all that. And for BPH, usually enlarged prostate, it happens frequently in men above the age of 50. Okay, and some of the signs, and the reason why is the prostate, as it grows bigger, it presses on the tube that runs through it. So one of the things people would see is that they feel, I want to urinate.
But
the person can't urinate. Or the person goes to urinate, but there's always this feeling that I have not finished urinating. Okay, and there's some things that are risk factors for that. If you have a sedentary lifestyle, if you very rarely exercise, if you consume a lot of red meat.
Don't look at me. Stop.
No, I know you exercise.
I do. Thank you very much.
Or you used to when I knew you.
I still do. Don't tell them. Let's go on.
Okay, so, and then also if you're obese, it's a risk factor as well. Now, we'll go to prostate cancer. Prostate cancer, the cause is practically unknown. But there are things we know. If you have a father or a brother that has prostate cancer, you are at high risk of developing it.
Oh.
Okay? It's usually slow growing, so most times people do not. most times, by the time people feel that they are feeling symptoms that could likely be due to prostate cancer, it's usually too late. It's usually, you understand, because it's slow growing.
If it's hereditary, can I arrest it?
Yes, there are things you can do. So, for example, you can screen for it. There's a particular test we call serum PSA. So we take the blood and they check for a prostate-specific antigen. Okay. So, but in that case, you also have, sometimes you have like false positives.
Okay.
So if you have elevated serum PSA levels, usually the doctor that sees you would ask you to probably do a biopsy. So they go in with a small needle into the prostate, they take a small slice, and then they examine under the microscope. So under the microscope, you now see whether some of the cells, are they undergoing what we call malignant change. So, and if that is the case, then usually at that point, they will just refer you to a surgeon. A surgeon would, there are multiple forms of surgery that would need to be done to arrest
So
that.
we're almost out of time, and I'm sure people, I'm the expert on this, so let me talk plenty. I'm sorry, Judith. So we're almost out of time, but people would like to know exactly what they could do to, well, hopefully not have these conditions that we're talking about.
Okay, so while I was preparing for this particular show, I just came up like a list of like 8 tips.
Please.
Okay. They're hard to implement because of the economic condition.
Real quick, because we're
so people will
almost
tell
out
you
of
the first is 5 servings of fruits and vegetables every day. Okay. Second is, as much as possible, you should prefer to eat whole grain bread rather than processed or white bread. That means bread that is baked from wheat berries.
Oh, okay.
Okay. The third is you reduce your red meat consumption and you eat white meat.
No.
Chicken that is without the skin, you eat more of fish, beans, and other lentils. Then you consume more of olive oil and less of saturated fats. And then you avoid sweetened drinks. So soda consumption, the regular, I won't mention names, but the regular sodas that we drink. And then you reduce your salt intake, you eat smaller portions, and then much more importantly, you become physically active.
What about sexually active?
Okay, so yes, it's interesting you mentioned that. There's been an association with
exercising your prostate glands with sex.
Yes, so people who do not ejaculate frequently, okay, are at higher risk of developing prostate cancer. So, and I'm sure that you're happy to hear that because it means that if you are active, if you are extremely active in the other room, it reduces, it lowers your risk. So we would ask you to, use your prostate gland.
Okay.
Yeah, well, listen, Nigerian men will take that as an excuse to to philander around. You know what I mean. But doctor, thank you so much for coming on.
Dr. Agunbiade,
thank you very much for having me.
Thank you for doing this, Dr.
Summarily putting
Agunbiade.
everything we need to know about prostate health.
Very
Thank you
nice.
very much.